Thank you, Mr. President, for this time to be able to voice my input about the insurance health reform. I will address some of the issues discussed today from a nurse's point of view. The first issue I will talk about is the increased health insurance premiums and deductibles. Americans are paying more out of pocket for health care now than they did in the past decade. According to Kaiser Family Foundation, the share of workers covered by employer-based health plans who face a deductible climbed from 55% in 2006 to 80% in 2014. A survey was conducted by the Commonwealth Fund asking consumers about these costs. Adults with low incomes were the most likely to spend a large share of their income on uncovered health care costs. Among the adults with private insurance, 13% had a deductible of 5% or more of their income. More than 2 of 5, or 43%, said their deductibles was somewhat very difficult or impossible to afford. High deductibles for privately insured adults have also created patients to report delaying or avoiding needed health care. 2 of 5, or 40% adults with deductibles of 5% or more of income reported that because of their deductible, they had not gone to the doctor when sick, did not get a preventive care test, skipped a recommended follow-up test, or did not get needed specialist care. This issue is a problem that will only continue to increase health care costs. Cost sharing in health plans is affecting people's medical decisions in ways that should be of concern to policymakers and the medical community. From my experience as a nurse, I have seen many patients who were admitted to the hospital due to non-compliance with their medications because they were not able to afford them. The large healthcare cost burden creates further stress for these patients and delays improvement with their medical problem. Another issue I will discuss that was brought up today by Representative Dave Camp is the individual mandate found within the bill. This insurance mandate and penalty fee will cause many Americans to become angry and upset by being forced to buy insurance when they don't want it or either they can't afford it. Critics view this mandate as an extraordinary intrusion by the federal government on individual liberty, one that penalizes individuals for failing to act, turning them into wards of the state, and unable to exercise individual choices. According to an article by Wendy Parmet, the attorneys general of more than half of the states and many private parties have fed federal court actions challenging the mandate's constitutionality. Polls report that about 3/4 of Americans view the mandate unfavorably. The mandate also requires an individual to maintain a minimal essential coverage. Some individuals might feel they are being forced to buy coverage they do not need based upon their health status, or either causing some individuals to lose their current coverage. From a nurse's point of view, patients are able to refuse medications or any type of medical care they wish to not participate in. It is important to respect the patient's wishes in order to maintain a positive nurse-patient relationship. A positive nurse-patient relationship is very beneficial when attempting to provide high-quality care to your patient. Forcing Americans to purchase insurance and charging a penalty fee when they do not secure the required coverage will create a negative mood among the American people. In closing, I would like to leave the group with a statement to consider. While developing this healthcare reform, the well-being of the American patients and delivery of high-quality care should be top priority. Thank you again for allowing me to be here today.